My name is Ejiro Pekule Oyowe from the Mono Osteopathic College of Canada, MOCC. Today, I will be presenting my hypothesis-based case study 8 on visceral manipulation. The title of my presentation is The Immediate Effect of Visceral Manipulation on Constipation, Abdominal Bloating, and Mechanical Lower Back Pain. Abstract. Constipation, abdominal bloating, and mechanical lower back pain may be associated with visceral dysfunction and fascial restriction. This hypothesis-based case study investigated whether visceral manipulation could improve visceral mobility, bowel function, abdominal bloating, and lower back pain immediately following treatment. The hypothesis proposed that treatment directed at the sigmoid column and the ileocecal valve would restore visceral mobility, improve bowel function, reduce abdominal bloating, and decrease lower back pain. Assessment include standing general listening, supine local listening, visceral mobility and motility assessment, spin-tack assessment, Chapman reflex assessment, and palpation. Treatment consisted of route of the mesentery release, sigmoid column indirect mobilization using the long lever technique, ileocecal valve release, and Chapman's reflex treatment followed by reassessment. Following the treatment, improvements were observed in visceral mobility, bowel function, abdominal bloating, and low back pain, supporting the proposed hypothesis. This presentation includes the abstract, introduction, methods, results, discussion, conclusion, and bibliography. Introduction. Constipation and abdominal bloating are common gastrointestinal complaints that may affect daily activities and quality of life. Mechanical lower back pain is also a common musculoskeletal condition. Osteopathic principles suggest that visceral restrictions may contribute to both gastrointestinal and musculoskeletal symptoms. The sigmoid column and the ileocecal valve play important role in normal bowel function. Restriction of these structures may increase fascial tension within the abdomen and the pelvis, contributing to constipation, bloating, and low back pain. Visceral manipulation is a manual osteopathic therapy technique that aims to restore normal organ mobility and reduce fascial restrictions. Current evidence suggests it may improve pain and function when used as part of a comprehensive treatment plan. The client presented with mechanical lower back pain, constipation, abdominal bloating, and discomfort during prolonged sitting. The assessment identified restriction of the sigmoid column with associated ileocecal valve dysfunction. The hypothesis proposed that treatment directed at these structures would improve visceral mobility, bowel function, abdominal bloating, and low back pain immediately following the treatment. Methods. A comprehensive health history was completed, informed consent was obtained, and contraindications were excluded before the treatment. Some of the assessment include standing general listening, supine local listening, visceral mobility assessment, visceral motility assessment, sphincter assessment, Chapman reflex assessment, and palpitation. The assessment identified the sigmoid column as the primary visceral restriction and ileocecal valve as the primary dysfunctional sphincter. Treatment progressed from global to local and focal techniques. The global treatment was route of the mesentery release. The local treatment was sigmoid column indirect mobilization using the leg lever technique. The focal treatment included ileocecal valve release and Chapman reflex treatment. The leg lever technique was modified by reducing the range of movement to maintain the client's comfort. And following the treatment, all assessment procedures were repeated. The client was advised to increase water intake, gradually increase dietary fibers, remain physically active, perform diaphragmatic breathing exercise, and return for a follow-up treatment. Results. Before the treatment, Standing general listening demonstrated a forward and left-sided pull through the lower abdomen and pelvis. Local listening identified the segment column as a primary restriction, and the visceral mobility assessment demonstrated reduced tissue glide, while visceral motility assessment demonstrated decreased intrinsic movement. Sphincter assessment identified dysfunction of the ileocecal valve and DJ junction, with the ileocecal valve demonstrating the greater restriction. Chapman reflex assessment demonstrated tenderness over the sigmoid colon reflex point. Following treatment, reassessment demonstrated improved visceral mobility, improved tissue glide, reduced fascial restriction, improved sphincter function, and reduced Chapman reflex tenderness. The client also reported reduced constipation, decreased abdominal bloating, easier bowel movement, less low back pain, and improved comfort during standing, walking, and sitting. Overall, the findings supported the proposed hypothesis. Discussion. The findings supported the hypothesis that improving visceral mobility may reduce constipation, abdominal bloating, fascial restriction, and mechanical lower back pain. And following the treatment, the sigmoid column demonstrated improved mobility, and the ileocecal valve demonstrated improved function. This improvement corresponded with reduced abdominal symptoms and improved movement. The client also reported easier bowel movement and less abdominal bloating immediately after the treatment. Improvement in lower back pain may be explained by the fascial relationship between the abdominal cavity, the pelvis, and the lumbar spine. This study has limitations because only one client was treated and reassessment was completed immediately after treatment. The client was advised to continue home care, remain active, stay hydrated, increase daily fiber, and attend follow-up treatments. Referral to the family physician would be appropriate if symptoms persisted. But overall, this case study supported visceral manipulation as part of a comprehensive manual osteopathic therapy treatment plan. In conclusion, this case study investigated the effect of visceral manipulation on constipation, abdominal bloating, and mechanical lower back pain. Assessment identified restriction of the sigmoid column and the dysfunction of the ileocecal valve. Treatment was performed using global, local, and focal visceral technique, which improve visceral mobility, bowel function, abdominal bloating, and lower back pain immediately after the treatment. And although this case study involved one client and one treatment section, the findings supported the proposed hypothesis. Further research involving more people and larger group size and long-term follow-up is recommended. This case study strengthened my understanding of visceral assessment, clinical reasoning, treatment planning, and reassessment within the manual osteopathic therapy. Bibliography: Barrel J.P. 2005, Visceral Manipulation 2, Eastland Press. Sheila A.G. ed. 2011, Foundation of Osteopathic Medicine, 3rd edition. Limpincourt, Williams and Winkins. Maurice L. Daly A.F. and Agu A.M. Arrow, 2023. Clinically Oriented Anatomy, 9th edition. Waterkloof. Drake, Arrohel, Vogue, A.W., and Mitchell, A.W.M., 2023. Gray's Anatomy for Students, 5th edition. Sylvia. Standridge, S.E.D., 2021. Gray's Anatomy, The Anatomic Basic of Clinical Practice, 42nd edition. Sylvia. Skilip, Arrow, Findley T.W., Scheitau, L. and Houngin, P.A., eds. 2012. Fascia Detention Network of the Human Body, Sylvia and Gulad A. Dabois, N. Monvosin, Arrow, and Pin South N 2018. Reliability of diagnosing and clinical efficacy of visceral osteopathy, a systemic review, plus 1, 13, open bracket 9, close bracket. Posadic P and NSE 2011, osteopathic for musculoskeletal pain patient, a systemic review of randomized controlled trial, clinical rheumatology, 30 open bracket 2 close bracket comma 285-291, 10 Ward Arrow CED 2023 Foundation for Osteopathic Medicine, second edition, Lippincott, Williams, and Wilkins.